Today we will discuss abnormal uterine bleeding, but really quickly. Are you fed up with lectures using complex vocabulary to appear smarter? Whether you're a current student or healthcare provider, doctor, nurse, or pharmacist seeking to remain up to date, this channel will provide a simple way of teaching emergency medicine in layman's terms. Here on Emergency Medicine on Demand, my goal is to help you retain tons of information in the shortest amount of time possible. Abnormal uterine bleeding, also known as AUB, refers to any bleeding from the uterus that is different from what is considered normal. It can include heavy periods, bleeding that soaks through one or more pads or tampons every hour for several hours, irregular periods, periods that occur more frequently than every 21 days or less frequently than every 35 days, bleeding between periods, any bleeding that happens outside of your regular menstrual cycle, bleeding after menopause, any vaginal bleeding after you've gone a full year without a period. Signs you might have AUB. Heavy bleeding, needing to change your pad or tampon every hour. Long periods, menstrual bleeding that lasts longer than 7 days. Irregular cycles, periods that come too often or too infrequently. Spotting, unexpected bleeding between periods. Painful periods, severe pain during menstruation that interferes with daily activities. If you notice any of these signs, it's a good idea to talk to a healthcare professional for advice and possible evaluation. If someone has abnormal uterine bleeding, here are some simple steps to take. Keep track. Write down when the bleeding happens, how heavy it is, and any other symptoms. Stay calm. Many causes of AUB are treatable, so try not to worry too much. Talk to a doctor. Make an appointment to discuss the symptoms. A healthcare professional can find the cause. Follow advice. If the doctor recommends tests or treatments, follow their guidance. Manage pain. Over-the-counter pain relievers can help with cramps or discomfort. Rest and hydrate. Take care of yourself by resting and drinking plenty of water. Seek help for heavy bleeding. If bleeding is very heavy or you feel weak, go to the doctor or an emergency room right away. These steps can help manage the situation and get the necessary care. In the hospital, if someone is experiencing abnormal uterine bleeding, the medical team may do the following. Assess the situation. Check vital signs like heart rate and blood pressure to see how severe the bleeding is. Take a history. Ask about symptoms, medical history, and any medications. Perform tests. Blood tests to check for anemia and hormone levels. Ultrasound to look for problems in the uterus or the ovaries. They will control the bleeding using medications to stop the bleeding or regulate hormones, maybe through birth control. They also give IV fluids to prevent dehydration. Possible procedures are DNC, which stands for dilation and curettage, procedure to remove tissue from the uterus if needed. Surgery. In some cases, surgery may be necessary to fix a problem. Monitor recovery. Keep an eye on the patient's condition and make sure they're stable. Follow-up care. Discuss long-term treatment options and follow-up appointments. These steps help manage the bleeding and address any underlying issues. Here are some commonly used medications for managing abnormal uterine bleeding. NSAIDs, for example, ibuprofen, brand name Advil or Motrin helps reduce bleeding and relieve pain. Naproxen, brand name Aleve, has similar effects to ibuprofen, but since it's more concentrated, you can take it only twice a day, while with ibuprofen, you would take that every 4 to 6 hours as needed. Hormonal treatments. Oral contraceptives in the form of birth control pills can help regulate menstrual cycles and reduce bleeding. Progestins, medications like medroxyprogesterone, brand name Provera, help balance hormones. Desmopressin is used for some bleeding disorders, particularly if the bleeding is due to von Willebrand disease. Tranexamic acid, brand name Listetta, helps reduce heavy menstrual bleeding by promoting clotting. Levonorgestrel releasing intrauterine system, brand name Mirena, a type of birth control that can be used to reduce heavy periods. These meds should only be used under the guidance of a healthcare professional, and of course it will depend on what the underlying cause of the bleeding is. Certain groups of people have a higher risk to AUB. These people include teenagers, young girls who have just started their periods might have irregular cycles, women in their 40s and 50s, those approaching menopause often experience changes in their menstrual cycle. Obese individuals. Being overweight can affect hormone levels, leading to heavier or irregular bleeding. Women with hormonal issues like polycystic ovarian syndrome, PCOS, can disrupt normal cycles. People who are very stressed can have, unfortunately, a bad impact on their hormones, and this may lead to irregular bleeding. Women with certain health conditions like thyroid disorders or clotting disorders are at a higher risk. Some people who are on medications like blood thinners, which would affect their bleeding patterns, are at risk of this. Being aware of these factors can help in monitoring and seeking care if needed. Now you need to watch my video on heart attacks or have a look at strokes.